Telmisartan-Hydrochlorothiazide is a medication used to treat high blood pressure, which can help prevent strokes, heart attacks, and kidney problems. It contains two medications, telmisartan and hydrochlorothiazide. Telmisartan belongs to a class of drugs called angiotensin receptor blockers, which works by relaxing blood vessels to allow for easier blood flow. Hydrochlorothiazide is a diuretic, also known as a water pill, that increases the amount of urine you make and helps to relax blood vessels for better blood flow. These medications are used together when one drug alone is not controlling your blood pressure. Your doctor may start you on the individual medications first before switching you over to this combination product if it is the best dose combination for you. It is important to follow your doctor's guidance on daily dosage and optimal timing for taking this medication. When taking telmisartan-hydrochlorothiazide, it's important to follow your doctor's instructions. You can take this medication with or without food, usually once a day. Try to take it at the same time each day to help you remember. It's best to avoid taking this medication within 4 hours of your bedtime to avoid having to get up to urinate. The dosage will depend on your medical condition and how your body responds to the treatment. Keep in mind that it may take up to 4 weeks before you start feeling the full benefits of this drug. Even if you start feeling better, continue taking the medication as prescribed. If you're also taking medications to lower your cholesterol, make sure to take telmisartan-hydrochlorothiazide at least 4 hours before or 4 to 6 hours after these medications. Remember to consult your doctor if you have any concerns about your dosing schedule or if you don't see any improvement in your condition. It's important to keep in touch with your healthcare provider throughout your treatment. As your body gets used to this medication, you may feel dizzy or lightheaded. You might also experience tiredness and diarrhea. Remember to get up slowly from sitting or lying down to help reduce the risk of dizziness and lightheadedness. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who take this medication do not experience serious side effects. However, this medication may cause dehydration and electrolyte imbalance. Contact your doctor immediately if you experience extreme thirst, very dry mouth, muscle cramps or weakness, fast/slow/irregular heartbeat, or confusion. Seek medical attention if you experience fainting, changes in the amount of urine, toe/joint pain, symptoms of high potassium blood level, decrease in vision, eye pain, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. It's important to contact your doctor or pharmacist if you notice any other effects not listed here. If you are pregnant or planning to become pregnant, it's essential to know that telmisartan-hydrochlorothiazide can cause serious harm to an unborn baby. It's crucial to prevent pregnancy while taking this medication. Make sure to consult your doctor for more details and to discuss the use of reliable forms of birth control while taking this medication. If you are planning pregnancy, become pregnant, or think you may be pregnant, contact your doctor right away. Before taking telmisartan-hydrochlorothiazide, make sure to inform your doctor or pharmacist if you have any allergies. Also, let them know about your medical history, especially if you have kidney or liver disease, dehydration, gout, or diabetes. This medication may make you dizzy, so be cautious when driving or using machinery, and limit alcoholic beverages. Be sure to stay hydrated, especially if you experience excessive sweating, diarrhea, or vomiting. It's also important to inform your doctor about all the products you use before having surgery. If you have diabetes, monitor your blood sugar regularly and talk to your doctor if you experience symptoms of high blood sugar. This medication may also affect your potassium levels, so consult your doctor before using any potassium supplements or salt substitutes. It may make you more sensitive to the sun and increase your risk for skin cancer, so take precautions when outdoors. Older adults may experience more intense side effects, especially dizziness. If you are pregnant or breastfeeding, talk to your doctor before using this medication. It's important to be aware of potential drug interactions with telmisartan-hydrochlorothiazide, as they may change how your medications work or increase the risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aliskiren, dofetilide, lithium, and drugs that may increase the level of potassium in the blood. It's also important to be cautious with products that could raise your blood pressure or worsen your heart failure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen/naproxen. Always consult your pharmacist on how to use these products safely. Additionally, Telmisartan-Hydrochlorothiazide may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. Lastly, always consult your doctor for the best time to take this medication and the optimal daily dosage for your specific condition. If someone has taken too much Telmisartan-Hydrochlorothiazide and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. For U.S. residents, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include a fast heartbeat, severe dizziness, and fainting. It's important to take the correct dosage as prescribed by your healthcare provider to avoid these risks. Remember, always seek medical attention if you or someone else may have overdosed on this medication. It's important to remember that you should not share this medication with others. While taking Telmisartan-Hydrochlorothiazide, it's important to have regular lab and medical tests to monitor your kidney function, blood mineral levels, including potassium, and skin exams. Make sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking this medication, lifestyle changes such as stress reduction programs, exercise, and dietary changes can help it work better. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. It's also important to have your blood pressure checked regularly while taking this medication. You can even learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of Telmisartan-Hydrochlorothiazide, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take an extra dose to make up for the missed one. When storing Telmisartan-Hydrochlorothiazide, make sure to keep it at room temperature, away from light and moisture. If it comes in a blister pack, only remove the medication right before using it. If it's in a bottle, keep the container tightly closed and don't store it in the bathroom. It's important to keep all medications away from children and pets. When it comes to disposing of Telmisartan-Hydrochlorothiazide, don't flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.